So here's how it works. What we're going to do is we turn it on first, and it'll go through its system check. It says system OK, and then it'll automatically go to the screen which has the wound size and the time. We do everything in centimeters squared. So if you have a wound that's 8 by 7, that's 56 centimeters squared. So whatever the length and the width is in centimeters, you just times that, and you find the range and the size. Okay. You can move the arrows up and down to find the range. So if we said it was 56 centimeters squared, it would be 50 to 60. That would take you 8 minutes to treat.
Which is a long time, isn't it?
That's 8 minutes is a long time.
That's a big wound, isn't it?
8 minutes? Is that a long time?
50 to 60 centimeters.
Yeah, it doesn't seem that long to
the
me.
4 minutes, sometimes your hand already gets...
a long time.
We can go up to 180 centimeters squared, and that'll take you 20 minutes.
Okay.
Just to
You
let
need
you
a
know.
break.
Yeah, we had a gentleman
So-
that was that long.
Okay.
So what you're going to see next is you're going to see the kit,
Should be carrying.
which is right here.
Okay.
And in the kit, you have an applicator, a chucks, and 2 wipes. So you're going to place your chucks properly with the patient. You're going to take one of your wipes. You're going to wipe the machine down. And then from there, what you're going to do is you're going to get your measurements, or if you already have them before.
Measurement, yeah.
The next thing you're going to do is you're going to open up the applicator.
Okay.
And just peel it away. Take it out. And it's an applicator connected to surgical tubing. And what you're going to do is you're going to take the tubing, and what I think is easier is if you spike the bag of saline first. So just to let you guys know, like a 250 cc bag of saline is going to last you about 13-14 minutes. A 500 will last you about 25. Okay. So this is a 150.
That's the only one that have provide for us on our
Oh, well, that's
course.
fine. That's fine. So what you're going to do is you're going to take this off, set this down, spike it, and then you're going to, this blood pressure cuff, you're going to place the bag of saline in the cuff, and there's a little hook up here, and you're just going to hook the bag up over like so. Okay?
Okay.
The next thing that we need to do is we need to pump the cuff up. And how that happens is you just look at the stopcock here, and this is the off position. If you look at it on the face of a clock, at 3 o'clock is the off position. We're going to turn that to 6 o'clock when we start it, and then the 9 o'clock is the deflate, and I'll show you how that works. Okay? So what you want to do is you want to, the first thing,
When you pump, you put it up.
you want to pump it up, but you also want to close this off
When you pump.
right here. Close this little latch right here.
Okay.
Because
Otherwise, you'll get it a little bit drippy. Okay?
Close
So-
that.
You want to put the applicator on the transducer tip, just like this, and it just pops right on there. All right? You can have it on there and then just holster it. So what we're going to do is we're going to pump the cuff up, and as we're pumping up, this little mark is going to go higher and higher and higher. And since we have a 150 in here, there it goes. So what you want to do is you want to pump this up to 300 millimeters of mercury. We're just past 150. And you'll see a little green tip come out here. And once it gets to the green tip, you're ready to go, which is going to be right there. So there's a green tip right there that lets you know that you're at 300 millimeters of mercury and you're ready to go.
300.
Yep. So once you're ready to go with that, we'll set that aside for right now. You're just going to take your applicator out, and there's a little handy clip here that just clips on the cord, just like that.
So that's for it. Yeah.
Yep. So it gets out of your way. And we have to hit start on the machine. And you hit select, and it'll say ready to treat, and it'll pop up here and say 8 minutes. And there'll be a green light that comes on the transducer to let you know that you're ready to go. So just to recap before we start treatment, what have we done? We did the measurements, the length and the width on the screen. We spiked our bag of saline, we put it in the cuff, we pumped the cuff up, and we put the applicator on and just clamped it shut so it doesn't drip. That's all we've done. Now when you're ready to do the treatment, you take the stopcock up to the 6 o'clock position, and you hit start. And you're misting. Now, if this is the patient that you were misting,
Slurp it onto, can I get this here?
yeah, just set it down right there. Go ahead and set it down.
It's amputee without.
Now, as you're misting, you want to be about a half a millimeter off of the wound bed. If you hear that gurgling sound, that's a good thing. You're not going to hear it all the time, but this is how close you should be. And you can see there's a little protector here that protects the skin from the transducer tip. So these actually jut out farther than the transducer. Yes. Yes. I mean, you're not always going to hear it, but if you just close it, you should be hearing it. So you just go back and forth in a slow manner and just kind of paint the wound back and forth. And one thing that's with this machine, you do not have to hold the button. And if you ever want to stop it, you can hit the button and stop it. You just clamp it shut again on the tube so it stops dripping. If you want to start it again, unclamp it, start it again, and you'll see the mist come out. And you just go back and forth on the wound. Okay? And the timer will count down, and when it's done, it'll beep to let you know that it's finished. And that's really it. I mean, you're just going back and forth on the wound, all over it. Like I said, you want to be about a half a millimeter off the surface of the skin. You kind of want to be, a good rule of thumb is as close as you can get to the skin without touching it. Yep, you just paint back and forth. And a couple of troubleshooting techniques with this. If you have this transducer tip, here I'll just bring it down here for the camera. If you have this transducer tip just a little bit off the applicator, off the studs right here, this is what'll happen. It'll almost look like see how it's just shooting out like that and not misting? It doesn't take much for it to be off. Now, why is that happening? It's happening because the mist is not getting on the transducer tip. It's just falling out.
So
When you have it on full and you hear that snap, that's where it's misting.
So you have to wait till it snaps.
Push it in hard and snap it. Yep,
Okay.
push it in hard. Because I'll have people say, well, it's not misting, it's just dripping, and if it's just dripping, you don't have it on all the way.
This is better than that way. The other was same one.
Yeah, and you have 360-degree range of movement with this, whereas with the bottle you didn't, because it had to drip by gravity, and this doesn't. So from a patient positioning standpoint, it's a lot easier to position that patient because you can get up like this and it'll still go.
There's a gentleman on the clinic trying
The only other thing that I'll show you is that there's something, sometimes you may get a frequency slip, and basically all that is something that's blocking the transducer tip. So if I put that tip in water and tried to turn it on, it would say frequency slip on the machine. So if you ever get that, just turn the machine off and turn it back on. It's just basically saying something's blocking the transducer tip. And that's it. And when you're done with this, you can just pop this off, the whole apparatus, the surgical tubing, pop the bag of saline off the hook, and it's all disposable. And you just throw the bag and the applicator out.
Okay, so how do we release the bag?
Okay.
I got a shower.
So now that you've done with the treatment.
You sit and you go from 6 o'clock to.
Now that you're done with the
I
treatment,
didn't know you had to turn it.
I actually shut the tubing down again so it doesn't leak. So we were at the 6 o'clock position in the on position. Now we're going to deflate and we're going to go to the 9 o'clock position.
Oh, okay. That's the one I did.
And that deflates the bag, and all you have to do is pop the bag of saline out. Take this out. Take the applicator off, and throw it all away.
Yeah.
And that's it.
Thank you. That was very clear.
And there's really, I mean, there's, as far as troubleshooting, that's pretty much
That's it.
That's it,
Yeah.
yeah.
That's it.
Yeah.
The only troubleshooting you're going to have with this now that we got rid of the bottle is if you don't have this on all the way,
Mhm.
it's going to look
Yeah.
drippy.
Drippy.
But that's it.
Yeah. It's
That
such
should
a
be the
much
only-
better stream. and
Yeah,
everything's
yeah,
Much nicer.
yeah. So, and like I said, once you're done, I'll just pop this
Yeah.
off
And shrunk it.
and throw it away. Now, one thing I do want to tell you is that because of infection control, these are one use.
One time.
So if you see this little half circle right here,
Mm-hmm.
if you take the applicator off, this half circle is going to pop up, and it will not let you put it back on.
So you don't put it on right the first time you take it
So,
off. You gotta
so
do it.
here's the thing: when you put this on the first time and snap it in, do your treatment and do not take it off, because if you take it off, you will not be able to get it
Get
back on.
another one.
Yeah,
You have to get a new
yeah,
set.
yeah.
Okay.
And that's pretty much
Thank you
Yeah.
very much.
So the gist of the treatment is get it close enough to feel the gurgling. And
well.
back
You
one
you
back.
get it close enough because, as I was saying,
Yeah.
our ultrasound waves travel on average 3 to 5 millimeters all the way up to 9 millimeters. We've seen, but if you're on the wound bed and you're like out here misting, you're not doing that wound any good. You should be right up here going back and forth.
As close as you can.
Okay, be right up here with the transducer tip, and that's when you'll hear the gurgling.
Okey-dokey. That's pretty
Where's
clear.
the sign?